Hello everyone, welcome, and I think we are coming back after a long break, but we are very excited because we are starting this series of talks with influencers, inspirational women, and today for the first one we have someone who is going to cover a topic which is very important for all of us. First, let me just add and then give the introduction. Just waiting for her to get added. I'm just waiting that for some reason I don't see Dr. Rashi joining in. Just give me 1 second so that I can get her added. Please bear with me for a minute. All right. I think Dr. Rashi has joined in, so let me just add her to our talk here. Okay, I think we have Dr. Rashi here. Hello, Dr. Rashi. How are you?
I am good. Thank you so much for having me here.
Thank you so much for joining in. So I have not given your introduction yet. I wanted for you to join in and then we can get started. So I'm going to start again. Thank you everyone for joining in. This is one of the first series that we are going live on Insta with influential and inspirational women. And today we have Dr. Rashi with us, who's a renowned psychiatrist and a mental health coach. So, Dr. Rashi, I would like you to give us more details about yourself and what you do and what's been your journey.
So hello everybody. Thank you so much for joining in. So I'm Dr. Rashi Agarwal and I am a psychiatrist, also a mental health expert. I love to bust all the mental health myths that are going around us and specifically working with a lot of women with hormonal issues and how that directly translates to affecting their mood.
Great. That's something so important in this day and age, because I think with the busy lives and the schedules that we all have, I think we all need some kind of solutions in terms of what we are going. What are some of the common emotional challenges that women face, and particularly in regards to their mental health, so if you could just share more details on that.
Oh God, this is like a never ending topic for me. I love talking about women and how much it affects the hormonal everything, how it affects the mood. So we all simply understand that women go through a menstrual cycle. And that depending on the person to person, invariably that affects your mood. Like some people have very less PMS symptoms and some people get very irritable and moody to the point that they have PMDD, like premenstrual dysphoric disorders. So yes, we both are hormones, the both progesterone and estrogen. Specifically they rise during the cycle, they reach their peak during the mid and they start coming down. And if we start applying the same concept to pregnancy as well as delivery, this approximately we can understand in a similar manner that how much the hormones increase during pregnancy and then their birth, there's a sudden downfall of all these hormones. So sudden change or sudden crashing in your hormones, as we say, this can surely affect your mood, leading to a lot of anxiety, sleep issues, as well as leading to the point of developing like complete inability to do your work, as well as to the point of psychosis. So, and specifically, we know that we are working towards gender equality, and also like we are a lot more empowered, I would say, than the previous generation. And yes, that is improving with every generation. But that does not take away from the fact that women in day-to-day activities have to go through a lot of emotional labor and emotional turmoil. So since a girl is born, she is somehow directly, indirectly, that is an unsaid thing, that she has been the primary caretaker, like the caregiver. So when she's small, she's taking care of herself, her people around her, and that just keeps translating over and over as she starts growing up. So we have this continuous, we say like in phrases, keep it in the back of your mind. Our back of the mind is a continuous running motor. It never rests, and it cannot, because there's so much emotional labor beyond what the physical and mental work that we are doing on a day-to-day basis. So yes, all this, carrying this for a long duration of time, can obviously translate into mental health issues.
Uh, Wow. So, I mean, I learned a few things which were new to me as well. So, just to, I mean, the audience, I guess I'll just give a background. Queen's audience is women, and women who, especially are mothers, majority of them are mothers, and they are also focused on wanting to restart their careers as well. Like majority, a lot of them are looking at that. So here we are looking at not just pressure in terms of your professional development, but also your personal health is very important while we try to balance everything. So in your opinion, what do you think, like from the society expectations, right? How do these gender roles, professionally and personally, impact women and their mental health?
Yeah, as we just discussed, when you carry this emotional labor for so long, depending on how much of family support you had, depending on how much people around you were able to share that load with you, and how much support you had, that and again, yes, it depends on a lot of your genetic makeup, how your family history has been, and what kind of, or the absence of any mental health issues in your previous generation. It is a very complex, we say, a biopsychosocial model. So bio meaning, yes, whatever is happening to you genetically. Psycho meaning whatever is going psychologically to you. And social means what your surrounding, like your immediate surrounding, your family, your friends, your work atmosphere. So this biopsychosocial, these three things coming together affects and decides what's going to happen to your mind, and how you are going to react to specific situations.
So, are there any ways that you could probably, foresee or overcome these challenges that you may, overcome or foresee, and how to overcome them? Are there any strategies or tactics that you can use, or therapy options?
Yeah. So first of all, like we say for everything, the prevention is obviously better than cure. So with every generation, like, yes, we are trying to raise better children. We are trying to raise children in a very gender neutral environment who are sharing the load at all levels. And not just that, like, you understand how generational shift happens. Initially, a lot of women were not working. Then many started working outside the house. Now in this current generation, the scenario is that women are working outside as well as doing all the household chores. So we are still in that transitional phase. We are where we have to go towards this equal work and equal opportunities.
Right.
So now it's like, okay, I was working at home, and household chores are like, I have been talking about this non-stop for the past 3-4 days, that never ending. Ask any homemaker and she would not have time to do stuff. And that is also the reason that a lot of women are suffering, because we are so involved in day-to-day activities around the house, we really have time for ourselves.
That makes me wonder about one more thing. Like, for example, you just mentioned, right? Like how now women are trying to do both. Uh, so from a health perspective, is it something that we need to make sure to balance, or it's okay to actually go ahead and do both? And still, how do you manage both? And it triggers a lot of stress, obviously, or anxiety. So how do you cope up with that, if because we are trying to do everything at the same time?
It is as it is difficult to just do one part of the job correctly.
Correct.
And then again, and especially with household work, you can do your office job perfectly. But with household, there's nothing called as perfection, and there's nothing called as end. You can finish an office project, you can never finish household work.
Exactly.
You'll start, finish one, and then a new one will pop up just right around the corner. So yes, as I just said, that just doing one, we don't even have time to do that one particularly and in an adequate manner. The problem is that we are doing both, and
Right.
somehow we have glorified overworking to the point that even when you work in society, it is so much exaggerated and hype that, oh, so and so, she goes to office and then 6 o'clock she wakes up, she's cleaning around the house, then she's cooking for the family, and then she's doing everything around utensils, etc., and on and on. Then she's leaving for office at 8:30, and when she comes back, she's doing all that all over again. And such person, obviously it's not her own will, and such people are used as an example throughout to shame other women that they are not doing enough.
Right.
The problem is that we have set very, very high criteria up for women, and none of us are able to meet that. First of all, it's very wrong to be in competition with one another. We all are doing the best that we can. But the problem arises when socially we are made to compare ourselves with other, and somehow it's not enough until the women are overworked. It's just imagine the kind of shame we receive as homemakers, where so frequently women are told that you are just staying at the house, you are not doing anything else. It's, my god, there's so much work around the house. How can you, like, you say to somebody that, and over and above, people say that you are servants and everything, but it's not just about the physical work, it's the emotional planning and the labor that you're doing continuously. We
Exactly.
all understand that I cannot leave the house before pre-planning each and every stuff. It's not possible for me to be like a man, just if I want to go somewhere, I can't just stand up and move. That's
Right.
that's
Yeah.
that's impractical on my part.
Totally.
Similarly, when we talk about working women, we are said that, oh, she's just working outside, she doesn't take care of her household, oh, she's not taking care of her husband, oh, the kids are just neglected, and things like that. So yes, so first of all, socially we have to start challenging the stigma. And as we all say, a very nice line I read this somewhere, that it's very easy to be a very difficult and a bad woman, and that's why there are so many of us.
I
And I
think
truly believe in it.
everybody will fall into that category.
And I'm so proud to be that bad woman, because I am changing the narrative and I'm setting the scenario right.
Right.
I voice this out again. Yes, depending on how much privilege and power you have around you and how much authority you established, it varies from person to person, that we start challenging this right away. That this is not right and this is not what's going to happen around me.
Right.
So yes, the narrative has to be challenged. Things have to change. And this is not going to happen overnight. Like we said previously, we were not working, now we are doing everything. This
Right.
has to shift. The household chores also have to, because when you are working and sharing the financial load, but still all the household chores are upon you, the planning and execution both.
So basically the work has to be equally divided, be it professional or housework or anything else. And that's why I guess you need a good partner or a good support system which can enable that to happen. Otherwise, yeah, I guess anybody can easily end up in a situation where mental health can be impacted. Me personally, this is just today's story. Like my husband is traveling and my maid's on leave. So literally I had to make like 10 calls to make sure my daughter is somewhere safe and gets picked up on time. And then again reaches home while someone is at home. Otherwise, so there are like literally 10 phone calls made to make sure everything is aligned. And then I'm just pausing and thinking, like, it just exhausted me so much just figuring all of it. And I'm like, none of this is to be done by the other counterpart at all, right? Like that's something that just we take upon ourselves. But in this case, because he was traveling, so that was okay, an exception. But but I think majority of us do it on a daily basis regardless, which is something what brings us to a situation of getting our mental health impacted. So
and that is
definitely,
automatic.
yeah,
Like nobody has sat us down and specifically told us, see, you have to do this. This is what we call a mirroring behavior. A lot of things we see how our mothers are doing it, and obviously this comparison thing and the strive to become the
yeah,
best. I will be the best wife. I will be the best daughter-in-law. There's nothing
right.
like it. I say, don't run in races you can't win.
Totally.
It's futile to run after that number one spot. You're not going to get it still.
Yeah.
It's useless. We are just over exhausting ourselves. See, I get a lot of hate. I say these things all the time. Uh, uh, Nowhere I say that you should not be doing work. It's our house, it's our responsibility. We have to do the household chores. The problem arises when all the emotional, physical, economic, and financial burden is on one person,
Right.
be it either party. In very rare cases, in a minority, yes, the males are earning, cleaning the house, cooking, and doing everything also. It wherever it tips, it's going to create a problem. That's why we need an off and on balance. It's not possible to do everything 50-50. So yes, there has to be some kind of a balance, not just for two people. If there are more people living around the house, there has to be some kind of arrangement
Of course.
so that the one person bearing it all does not end up in some issues. I see so many women on a day-to-day basis who just come, they are clear cut in very like good depression, like moderate to severe depression. And when you ask them, as such, there is nothing bad going on. Like there's no specific fights in the family, there is no big stressor, but it is just accumulation of very small things over a very long period of time. And when they start in the therapy session, when they start from the very beginning of their marriage or even before that.
Wow.
So it's been 20-30 years they've been carrying that weight around, and then eventually one day there is that breakup point.
Right.
And for people who say that there were not issues previously and just these days people are just coming up with them, I see women of all ages, 60 plus also. So yes, they were suffering at 40 years also.
Oh, wow.
They just did not have a platform or the right information or right people to reach out to probably at that point of time. So yes, stigma is decreasing. People are moving around and seeking help. But yes, this needs to penetrate more. So the less stigma we have, the more people are going to come up, get out of their house and seek help for themselves.
This like you said that there are women who are even maybe carrying the weight since 40 years, right? So how does one really understand if there is some sort of depression that they're going through? Maybe they just didn't realize for so many years. So how do you identify it at an early stage so that you do not carry that weight for so long?
There could be very small signs. We say like your sleep probably would be the first one to get affected. So it's not necessary that the person would end up crying or being sad a lot. There are very subtle physical signs also that might be present, like I said, loss of sleep or irregular sleep or inadequate sleep. The difference between this is inadequate sleep means that, okay, I slept, but I'm not fresh in the morning. It's not enough for me, or it's not enough to refresh me. Then loss of appetite, loss of libido, not finding pleasure in regular things. Like previously, if you had hobbies or activities you looked forward to, you have stopped doing that. You have difficulty in concentrating in your work. You have difficulty in paying attention to details. You are very forgetful these days. Or you feel a lot of palpitations. You have a lot of, like we say, lump in the throat very frequently. So there are so many signs to look out for. But if you just start feeling that, okay, I am maybe, it's just enough for the person to start feeling, I am not well. Even if you have this kind of feeling that something somewhere is wrong, then there's no harm in going to a professional and getting that checked out. See, even if we feel febrile, it's okay, I wait for 1 day and 2 days, oh, it might go away. Then eventually we go to the doctor, right? When the fever gets high enough or we feel weak enough. So similarly, with it would have been better if you would have gone to the doctor like earlier.
Yeah.
Similarly, with your mental health issues, I have these women, I have these people come up and say, I was planning to do this for the past 6 months. I knew that I had this problem for 5 years, and I just gathered the courage today to do that. So imagine being in planning for something for 5 years, not being able to take out time for yourself in 5 years.
That's a
That
long
is,
time.
and many times it does not seem plausible also, that how could somebody not take out one day, half a day for themselves in the 5 years of duration of time. And believe me, it is possible, because the amount of workload, amount of responsibilities, and again,
We don't
us being in,
prioritize ourselves
yeah,
probably also.
yeah,
Right.
because it's like ho jayega. Others obviously needs come before us, be it due to time deficiency or economic deficiencies. We are habituated to put others first.
Right. Right. Yeah. Um, so we definitely don't prioritize ourselves, and that's why I think it goes on for so long. But that's definitely a learning that how you put yourself first in the situation, and then I think only then you can help others. If you can't help yourself, then everybody in the family is probably suffering because of the same issue. I wanted to understand more in terms of, if one person is going through something of that sort, then how can they take help? Like, how can they seek help? Is there any treatment plan or any guide or any medications that they need to take to solve uh, what they're going through?
Okay, see, the first and foremost, there are a lot of natural ways to do that. Like we very frequently say, have an adequate sleep. If you have started sleeping, if you just work on your sleep cycle, and if you, depending on whatever your requirement is, 6 to 8 hours, if you try to bring it in a routine and at time, it surely can help with mild issues. Secondly, having a proper meal as well as a proper specific schedule with good exercise. Good exercise, textbook says around 30 minutes of like moving around is sufficient for you to have that like non-stagnant phase, as well as just trying to lessen your burden. But yes, if things are not being able to, like, not being able to correct them because of, with these things, meditation helps, yoga helps, at least for anxiety, deep breathing exercises, and a lot of these things, journaling. In mild, a lot of things can be done, specifically deep breathing. And I am thankful to social media for that, that so many people are now aware of that, and they practice that with videos and all these like tutorials and guides in how to do, and people are doing that. That's very good for centralization for yourself. Beyond that, if you still feel okay, I am not well, so yes, first of all, go to a professional so that you can get a very rough diagnosis. Like we said, we do not diagnose in the very first visit. Our main aim is to gather information of what you're going through and start helping you. Depending on whatever you're going through, your doctor is going to advise you like medicines and or therapy, and both. So generally, if there is family issues, interpersonal issues, we lean more towards therapy more than medicines, along with low dose medicines. And if there is actually no social causes or very less social cause, and a lot of illnesses are inherent, like genetic component. As I said, there's no specific stressor going around. So yes, this depending on person to person, it's a very tailor-made procedure about what kind of treatment plan you're going to come up with. But yes, starting both together is a very good option.
Um,
With meditation, like
so,
medications and therapy both.
so did I get this right, that even if I don't have any issues around me, or there are no stress factors that are really bothering me, I could still undergo depression just because of hereditary uh, issues?
Yeah.
Yes. Oh,
Like we just said, it's biopsychosocial. So even if socially it's everything is fine, and everything like 100% cannot be fine, there has to be some kind of ups and downs in your social and personal life. Yes, so people can end up, like we discussed, hormonal. One big factor is that even if socially, even to the point of, like we said, postpartum depression,
oh my gosh. Okay.
postpartum psychosis, just because a person has delivered a baby. So yes, so hormonal is a very big reason that people would go through a lot of mental health issues. And yes, but most commonly people come up due to social factors that are happening around them.
I am also reading some of the comments, and everyone who's watching, please feel free to ask questions. But There's some comments saying that I've seen people who has depression for long period. Even I have suffered to this, and my mom and dad as well. So I guess when it is hereditary as well, and it's gone for so long, seeking treatment is probably the first thing that you need to do, right? Any other, I mean, things that can be taken care at home, definitely physically, as you mentioned, keeping your physical health also better. What are other alternatives? Because I know there is a lot of taboo also around seeking for help. So I understand that when someone is going to the doctor, it's very casual, but when they have to go to a psychiatrist, it's like considered a really taboo thing to do. So how do we tackle that taboo as well and normalize that? That is very important. But seek the help in a way that it doesn't impact the person who's seeking help as much.
Yes, so first and foremost, this is what we are doing here. So that the more we talk about it, the less stigma there is. The more people come up and openly accept that, okay, this thing is wrong and it's okay to have anxiety and everything like that. Very frequently now I'm seeing the lingo and the type of conversations teenagers and young adults are having. It's very different from what we had back in the day. I do not remember using the words like anxiety or depression or even knowing about them. Right. So yes, this is how we say that the stigma shift is happening. That young people very frequently, they are saying, oh, I had anxiety about this, and I went to my therapist, then she advised me this, and now I'm feeling better. So like this, there is a shift, obviously. But yes, one thing is that a lot of change has become because of COVID also, that now you can get help from the comfort of your home. And that is a very, very big deal, because you don't have to go out and start face people. You have to face people to enter a particular hospital or a particular clinic.
That really helps. Yes, yeah. Then it's definitely something that you can do from home, and nobody really needs to know about it, and you still can actually resolve your issues and get help. Now, when a lot of women in our audience either are going through postpartum depression or maybe menopause, because it's that age group that who are connected with us and are looking out. They primarily are looking out for opportunities, but there is definitely, because of the break or because of certain social barriers, there is always that weight being carried. So to solve these issues, how can mental health professionals help?
Just with postpartum depression, I would just like to quote one scenario. I was treating one person. I treated one lady back in 2020, late 2020. She came with severe postpartum depression, and it went untreated for 1 to 2 months, and it translated to postpartum psychosis. So was also admitted and giving medication, and eventually in 2-3 months she was completely fine to carry out her activities, and the family was lost to follow up with me. I just saw the husband 2-3 days back, and he specifically came to my offline, like for my practice, and he said, these are the documents. I said, how's your wife now? What's going on? Are you planning another baby? He said, no, I told her at that time only, I filed for divorce, and I want this in writing from you that she's crazy and things like that, so that it would be easy for me. The whole day, you cannot believe, I was so pissed off at everybody. Things like this stay with you and they affect you so much. It shouldn't, like being a professional, I should really try to come out of it. But there are days when you hear such things and you are like, it's very easy to start talking about depression and anxiety and say, kuch nahi hota. And everything just goes away and there is no stigma. And when you work at ground level and you see things like this, that's the exact point of time you realize how much it's affecting the life of people. Imagine she being completely fine now, just having one episode of postpartum depression in the past, and now the family is filing for, they've already filed for divorce, and she has a 2-year-old child now.
Oh my goodness.
And that is the point, and that is, I think, the basic motivation behind whatever I do on a day-to-day basis, so that people do not have to suffer this. And this is despite of, I remember at that point of time, repeatedly counseling and telling them that this is not something genetic. This is not like that it's going to completely, it's not like diabetes. Like, 100% chance thodi hai ki it is going to translate into all other children. Obviously, there is a risk of genetic carrying everything that you have. And I remember having this conversation at that point also, that should we separate if this is not treatable. So yes, I say postpartum depression is very, very easily treatable, very easily manageable. People just from the second visit, they start saying they're feeling better. And from the third visit, they're able to go back to your normal life and start doing all the activities of daily living. So please, please, please get help. Please get treated. And such kind of stigma really needs to die. It's disheartening to see a family break because of this. And I do not know how the person is going to go through with this, because it's no more a legitimate reason for divorce. There have been so many changes in our financial, in the court settings also. Mental health issues are no more a ground for divorce. It cannot be cited as such.
Uh, Thank you so much. I think that really sums up in terms of that when you feel something different, when you are not your 100%, definitely seek out for help. Don't shy away. Prioritize yourself. There's just one last question that someone has asked. So I think I'll just ask that and then we will wrap up because we're already over 30 minutes. Someone's asking that how do you figure out when someone else needs the therapy, and how do you convince that person, because sometimes you could be in a denial for a very long time. So how to convince your partner or that someone who you care for to seek therapy?
It is very difficult. I know that I get people day in and day out dragging other people inside. But yes, if you are someone who's that close to you, and you feel that they're going through something, it would not be easy if they are not ready for that. Having repeated conversations with them, showing them examples of people who have gotten better in the similar condition, and just making them realize that this is not something they need to be ashamed about, and how much their life can change from one simple, just one session, just one consultation. A lot of patients have come and said that it changed just after meeting you. So they need, see, you get a lot of validation also. You get a lot of answers to so many queries that you have been carrying for so long. So many people just come, they sit and they start crying. That's all. They have nothing to say. They feel so relieved that finally they are getting the help. And that's also a lot of burden that's lifted up from you. So yes, it is a repetitive efforts. And plus, yes, again, I use social media for all kinds of gains. Show them these informative them. There are a lot of online assessments, sessions you could go for them also. But yes, it is going to be you have to keep going in circles with that conversation until you have to literally drag the person for that.
Great. Thanks, Dr. Rashi. I know it's not an easy task for even to do this kind of work, because every day I think it must be even for you emotionally getting involved and actually understanding everybody's conditions must be a very challenging task, and trying to find that solution. So we really appreciate the work that you do, and thank you so much for sharing your insights with qween members. We hope that we can connect again and have another session where we can go deeper into this, because I think a lot of people are needing it. It's just maybe being in a denial stage or just shying away from it, which is now needs to be stopped. I think we need to come out of that stigma and taboo and really be open about what we feel, so that we can find a solution and be our best. So thank you so much for joining, and I hope you also had a good time participating and sharing your insights.
Thank you so much for having me. It's always a pleasure to talk about mental health. And yes, people seek the right treatment at the right time, because uh, why delay? Start living your best life from today. So please get the right help, and link is in bio if you want to start and have a conversation or a consultation with me. So take care. Have a very good evening.
Thank you. Bye-bye.